patients, hospitals making emergency demands, some doctors and nurses running low on protective gear, many reusing their masks, some hospitals reporting a 50% surge in coronavirus patients.
We're being told about supplies on the way, and what is actually happening in ERs is one of the many angles we're exploring tonight. As far as the numbers, no surprise, they're going up. And they will, say authorities, unless all Americans accept what's at stake and what we must do.
Cut short. Hundreds of people arriving before 4:30 this morning, waiting in a mile-long line at New Jersey's biggest drive-through testing site. But just 30 minutes after opening, they hit capacity, and police had to turn people away. Medical professionals now advise that only those with severe cases seek medical help. Inside hospitals tonight, there's growing concern.
It's a scary time to be a doctor in America, and especially in New York.
Dr. Cornelia Griggs, a mother of two, is a pediatric surgeon who works with coronavirus patients at Columbia University Medical Center. She says she's worried the hospital could run out of masks, eye protection, and
As the coronavirus crisis deepens and the U.S. government pleads for Americans to go home and stay home, scenes like these are unfolding in cities across the country, from canceled festivals to farmers markets, and at beaches and basketball courts, many are ignoring the message to keep their social distance of at least 6 feet from one another.
I want America to understand this week it's going to get bad.
The Surgeon General, the nation's top doctor, says this is exactly how the virus spreads.
There are not enough people out there who are taking this seriously, and you just see it looking in California, people on the beaches. You see it in Washington, D.C., the people out looking at the cherry blossoms. We need to take this seriously.
With a growing list of governors in well over a dozen states now ordering residents to avoid leaving their house, more than 140 million Americans are joining the more than 1.5 billion people globally told to stay inside. The World Health Organization warning the pandemic is accelerating, with more than 300,000 cases recorded worldwide, the sick now in nearly every country.
I couldn't walk, I couldn't speak more than maybe 1 to 2 words.
Fiona Lowenstein, a 26-year-old New Yorker, is among the growing list of young Americans testing positive for the coronavirus.
Everyone was asking, okay, but are you autoimmune compromised? No, I am kind of the picture of health in many ways, and I still got really hit by this very hard.
As communities big and small scramble to scrub and keep public spaces clean, even iconic landmarks like Yosemite are closed indefinitely. The National Guard is providing support in all 50 states. Officials are now worried cities like New Orleans and states like Florida and Texas will be next to be hard hit by the virus.
We don't have enough personal protection equipment. We don't have enough testing and collection equipment. We have the money for it, but the supplies are not available for us to be able to purchase.
In a country in lockdown, the dead are buried without relatives to mourn them. In a cemetery in Barcelona, just a solitary priest is present to pay last respects. A fate awaiting hundreds as the death toll continues to climb across Spain. In the capital of the country, hospitals are reaching full capacity. Here the halls and waiting rooms are packed, standing room only, as they wait for someone to treat them. In another Madrid hospital, patients lie on the floor because there are no beds left. Jose Cabanas, whose mother is still in hospital in Barcelona, says staff there told him the pressure is relentless.
Someone said to me that when they had the terror attacks, it was a moment they had a lot of people arriving at the same time, but that was it. And now it's a constant flow, and they have difficulty managing it.
How did Spain become one of the worst affected countries? This may have played a key role. Thousands of Spanish football fans travelling to Bergamo in Italy for the Atalanta-Valencia game on February the 19th. The city's mayor called the game the bomb that exploded the virus.
The balconies have never looked busier. Italians seeking fresh air from the confines of their home. The strict lockdown has restricted people's lives beyond measure. But this is Italy's new normal. Almost everyone now wears masks. If you don't, it can cause visible panic. But the streets also seemed much busier today. The strain of 2 weeks in lockdown perhaps showing.
All'inizio c'era un po' più paura magari, ma adesso secondo lei la gente esce un po' di più?
No, adesso invece credo che abbiano preso proprio sono consapevoli della cosa e credo che abbiano molto più paura. Infatti agli inizi giravano senza guanti, senza mascherina, adesso sono poche le persone che girano senza la protezione.
Italy has tightened its lockdown further in recent days. The military now deployed to enforce measures, and passengers' temperatures are taken at train stations, with internal travel now banned. There are early signs these measures may be slowing the virus spread, but as the number of dying continues to soar, positivity is dropping.
With cheery music, the Spanish government is releasing footage of field hospitals being built, but also fighting allegations it didn't see this outbreak coming early enough or do enough to stop it.
The
increase in fatalities today is not statistically higher than we've seen 2 days ago, which was showing a more stable tendency which continues despite today's increase.
More and more doctors and nurses are becoming infected. Radiologist Sergio Del Rio is recovering in isolation and says the health system has seen nothing like it.
We're having cases of patients dying in our hands, but in absolute solitude. These patients have to be completely isolated, and they're dying in the hands of the doctors. And us healthcare workers have to go home in fear of transmitting the virus to our families. The situation has got the better of us. I've never seen so much fear in either the faces of the patients or the healthcare workers.
So many are dying in Madrid. The city's ice rink has become its morgue. The lorries arrive bearing the dead with grim frequency.